key people from across our area who work in the social prescribing field to share what they do with us. But we're going to start with introductions today. We try and do this most meetings because a really important part of Hatch is, even though everybody's only 2D on their screen and we're not all in the same room, that we use this as a networking opportunity. So if you meet somebody in a meeting who you think, oh, I'd like to know more about that role, or I think they could be useful, or I could be useful to them, we always can share the emails. You can get in touch with each other through the chat or afterwards. Please do that. It's really important that we use these meetings to connect, even though we're not actually all connecting in the room anymore or at the moment. So I'm going to call out people's name, and if you could just introduce yourself, where you work, and just a sentence or two about your role, that would be fantastic. Thank you. So I'm going to start with Baljeet Birdie.
Hi there, everybody. Good afternoon. My name's Bally. I'm a Senior Locality Officer. I work in Safer Stronger Leeds communities in Inner East, and I do project work. Nice to meet you all.
Thanks, Bally. And Emma, my colleague Emma Bullock. Hello.
Hi, I'm Emma. I'm the PCN Manager for Chapel Town.
Thank you. And Nina Davis.
Hi there, I'm Nina Davis, work for Leeds Community but across the system, focusing on diabetes and soon weight management. So that I'm really there to bring the system together so we all talk to each other.
Okay, nice to see you, Nina. Hi.
Good to see you.
And hello, Tracy Foster.
Hi everyone, I'm Tracy. I'm occupational therapist working in Chapel Town Primary Care Network.
Thank you. Ian Kenning.
Hi everyone, I'm Ian Kenning. I work for the communities team, part of the council, one of the locality managers. So I support partnership work in Bermondsey, Richmond Hill, and increasingly in Hare Hills as well.
Thank you, Ian. And Maddie Thompson.
Hello, I'm Maddie Thompson. I'm from Urban Foresight up in Newcastle, and I'm working with Rachel Dukes and Judith Fox on the DFT Active Travel project at the moment. So we're going to be providing some monitoring and evaluation services.
Yeah, great. I think we might be hearing more from you later. Thank you. Thanks for being here. Natalie Howcroft.
Hi, I'm Natalie Howcroft. I'm from Lincoln Leeds, one of the senior wellbeing coordinators. In my role, I do a combination of client work and manage a small handful of the team as well.
Thanks, Natalie. We'll be hearing more from Natalie a bit later in the meeting. Nick Chapeltown, that can't be your surname, although it'd be nice if it was. Nick from Chapeltown Citizen Advice.
Yeah, I'm so wedded to Chapeltown, it's now my surname.
Right.
Nick, I'm Chief Officer at Chapeltown Citizens Advice. We've got a number of pieces of work that obviously we're doing in Chapeltown, but prime thing at the moment is, and always has been actually, but benefits, gas, electric, those kind of things.
Thank you, Nick. Chetna Patel.
Yeah, hi everyone. My name's Chetna. I work in public health, focusing on the Inner East area in the primary care and localities team. Hi everyone.
Hi Chetna. And Rifat Malik.
Hello, my name's Rifat. I'm the director of Give a Give charity, but I'm also an executive board member on the local care partnership, the Hatch. And this is my colleague, Hannah.
Hi, everyone. I'm project worker at Give a Gift.
Hi, hello, both of you. And Tabaro? No. Come back to that one. Sam Hurst? No.
Have you got me now?
Oh, who's that?
You've got me now. Sam Hurst, apologies. Yeah, my name's Sam Hurst. I am a patient ambassador working for Hamara within the Bermondsey, Hare Hills and Richmond Hill district, PCM.
Thank you, Sam. And hi, Dr. Mo Sattar.
Hi, I'm a GP at Woodhouse Medical Practice and also Clinical Director of Chapeltown PCN.
Hi, Mo. Louise Sellers.
Hi, I'm Louise. Sorry. got grape stuck in my throat then. Project Support Officer for the LCP development team, working alongside Rachel.
Thank you. And Mamta Sharda?
Hi everybody, Mamta Sharda, Migration Project Coordinator with the migration team. So I manage different migration projects such as asylum seekers. Currently I'm working on Homes for Ukraine project.
Thank you, Mamta. And Rachel, hello, Rachel Ainscoe.
Hi everybody. So I'm Rachel. I'm one of the development managers working in the local care partnership development team. Sorry I was slightly late. I'm here now. Great to see everyone.
Thank you. And Laura Bryson.
Oh, hi there, everybody. I'm from the Cancer Services and the Community Cancer Services in Leeds.
Thank you. And Ellen Fisher.
Hi, sorry, I was a little bit late to joining the meeting. I'm Ellen. I'm a health and wellbeing coach working for BHR PCN.
Thank you. So great to have so many people. Is there anybody who's not had an opportunity to... Sorry, you're the person with an unlikely name of BSA Wellbeing.
Yeah.
Sorry.
For some reason, it's not letting me change it.
Okay,
So my name's
go ahead.
Emma. I work
Hi, Emma.
at Birmingham Senior Action. So we support the over 60s in the LS9 area of Leeds. And I'm the enhanced worker. So I work under a project which is run by the NHS, Leeds City Council and Leeds Older People's Forum, and it's about trying to keep the most vulnerable over 60s well at home. And if anyone has any complex medical needs like going to hospital or things like that, I work with the discharge team trying to get them home quick and safe as possible. So yeah, that's me.
Thank you, Emma. And Sahil.
Hi, Sahil, Operations Manager working for both BHR, PCN, and Hamara. So my role is to develop partnership work within communities, look for the gaps and try to plug those gaps. I was just going to say, actually, this meeting and the previous one, there's myself down as Hamara, and then there's Ellen Fisher who's down as BHR PCN. From this point forward, if we could just have them together, and then myself and Ellen will alternate as to who's going to update on whichever meeting, if that's all right.
Sure, I'm sure we can. I'm sure that'll be fine. We'll take a note of that. Thank you, Sahel. And Victoria Staunton.
Hi, yeah, I'm Victoria Staunton. I'm the service manager for the North neighbourhood teams. So that includes Chapeltown, Seacroft, Weatherby and Meanwood.
Great to have you here, Victoria. I don't think we've met. Nice to meet you. Rachel Dukes, got your hand up?
Hi, I'm Rachel Dukes, also from Public Health and the Council. One of the project leads for the Department for Transport Social Prescribing pilot that's running for the next 3 years. So lovely to see you all and to meet you all, those I haven't met before.
Thank you, and we'll be hearing from you later in the meeting as well, so we can learn more about that programme. Thank you. And Tabaro, you've put your name in the chat. Would you like to say hello? Or maybe he hasn't got, maybe he or she hasn't got a microphone, and it's just the chat. Okay, that's fine. Lovely. So 24 people in the meeting now. Alex Bergen actually has just joined us, just in time to introduce themselves, which they won't have been expecting.
Sorry, my internet's playing up. So I work for the RHS. I'm the Senior Community Outreach Advisor at the RHS, and I'm just sitting on the meeting just to find out a little bit more. I've worked with Lincoln Leeds and with Rachel Dukes as well, and we're just at the minute creating a healing garden at St James's Hospital, so I'm just interested to sit on and see what's going on in the area.
Great. Welcome. You're very welcome to join us. So thanks everybody. So yeah, loads of people here from loads of different backgrounds, able to share what they're doing and to learn about social prescribing, which is our focus for today. Linking Leeds has been around for a number of years in Leeds and has been a fantastic service, and has been joined more recently by a number of social prescribing workers linked to primary care networks. So we're going to be hearing from social prescribing from all those settings today. I'm not going to assume that everybody knows what social prescribing is, so just to set the scene right from the beginning, it's how we support people to improve their health and well-being by linking people to services or organisations that can help them. So we're addressing their needs in a holistic way. And certainly speaking from perspective of a GP practice, and I'm sure those clinicians on the call would agree with me, is that we often see patients who come to us with clinical issues, but actually the underlying issue is one about their well-being, their housing, their work situation, their financial situation, whatever it is, and actually being able to look at and help them solve those issues just improves their well-being all round. So it's been such an important service for us to work holistically. So we're going to make sure this is an interactive session. So please pop any questions in the chat, and every speaker will be happy to answer questions. If there's one thing we expect from everybody that comes to a meeting, it's that they engage and don't just listen. So please do ask questions, or if you have points to add or additions that you want to make, then please do make that. Okay, so we're going to hear from Linking Leads first of all. So Linking Leads is the Leeds-wide service which citizens can refer themselves into as well. Before we move on to small localised services from Chapeltown and BHR. So I'm going to hand on to Natalie Howcroft, who introduced herself earlier, Senior Wellbeing Coordinator for Linking Leads. Thank you, Natalie.
Hello, thanks for inviting me to come and speak today. Hi everyone. Hi. So I've just got a little presentation to share with you all. So I'm just going to share my screen. So bear with me. If there's any questions in the chat, I'm not sure if I'll be able to see them while I'm presenting. So bear with me on that one. I'll just share now. Can everybody see my presentation okay?
Yes, we can.
Fantastic, wonderful. Okay, so I'll just start off. I think it's just already been mentioned, but just a little bit about Linking Leads in terms of an overview. So we're the third sector citywide social prescribing service for anyone aged 16 plus and registered to a GP surgery in Leeds. And as been mentioned, we work with people to link them to services and activities that will improve the health and well-being. So it can be anything from housing issues, money management, emotional, social and mental well-being, meaningful use of time, community connections, so a number of things, a number of social needs. And what can we offer? Time, really important. Sometimes people just need the opportunity to offload, and that's what our assessments offer. Just a little bit of time to talk, which sometimes they don't often have the opportunity, or they may not have somebody to talk to. So we try and elicit from people what matters to them. What are people ready to change? What changes would they like to make? And as part of that, we do a co-produced action plan with people and very much take a holistic approach, as has already been mentioned. So we link to other services. We focus on social needs, not clinical needs. We're generalists, not specialists. So we don't focus, or we don't have any particular skill set in terms of being the specialists around mental health or specialists around finances. Our specialism is knowing what's available and connecting people to that. And we work with clients for up to 3 months. So in terms of who can refer, anyone. A GP, primary care professional, people can self-refer, other services can make referrals, or other people can refer in, such as family, friends, etc. The easiest way to do a referral is online. We have a really simple online referral form. I'll give some contact details at the end as well, and some information about how you can get in touch with us. In this area in Hatch, we currently have a 4 to 6 week wait for a wellbeing coordinator to get in touch. So in terms of the process, a very simplistic overview is a referral will come into our service. The person will have an initial phone call to welcome them, clarify what their needs are, what it is they're looking for, and then an assessment, an holistic assessment will be booked for people, and that can either be done over the telephone, remotely over Zoom, Teams, or it can be done in a GP surgery or a community venue if we can gain space, such as a hub, a library. We like to try and be as accessible as we can for the person, and we use a number of assessment tools and create an action plan. Then there'll be a series of review appointments to look at the goals that the person set as we work with them. And then a final appointment will review those assessment tools and kind of look back and reflect with people. I'd thought I'd give an idea to everyone of the last 6 months what our most common referral need has come through for. So as you'll see, the top two highlighted are kind of the needs are coming through feeling stressed, anxious, needing emotional support at 37%. And the second highest was needing advice on health, housing or finance issues. I don't think any of those two things will be a surprise to anyone. So just to give you a bit of an idea, I will share these slides at the end as well, if people would like those. What I thought I would do as well is give some examples of the top two things, how we would support a person through those needs. So rather than giving a specific case study, I thought I'd give some general examples of the type of work we might do with people. So, for example, we could liaise with the GP. If there was a clinical need, for example, the person wanted to look at medication or a request for a referral to primary or secondary care, we would go through the GP and liaise with them around that. We try and encourage people, because when there's a mental health need, people come to us and they say, I want counselling. So we try and expand people's understanding of what else is available aside from counselling. So we would look at things like online resources, self-help, even apps. Things like Wobot's been great, like an interactive app for people. We really encourage people to look at self-care and connection with others and what brings them joy. Counselling is absolutely fabulous, but always counselling is not always instantly available or free. So we try and look at things that while people are waiting, what they can be proactive, what they can do, and kind of look at opportunities for that. We look at things like peer support, drop-ins, give them access to helplines if they needed somebody to talk to, make sure they've got all that information. We also do look at other options for counselling as well as Leeds Mental Wellbeing Service. There's lots of connections we have with low cost counselling. A lot of people are on the call here, things like UK Counselling Network, Phoenix Health and Wellbeing, and Black Health Initiative. There are some free options for counselling, very limited and sometimes close quite quickly when they open, but there are kind of opportunities that are there. So we do look at things like that with people around mental health. So we just try and expand people's understanding of what is available rather than just I would like counselling and that's it. In terms of examples of help around health, housing and finance issues, some of the things we can help people with, so we can refer and signpost to Engage Leeds and Better Leeds communities who've got a fabulous advice line for housing. Around health, we'll often refer to adult social care, things like Home Plus as well, needs assessments around mobility needs and equipment needs in the home. We encourage access to health services in the GP surgery. Sometimes that might even be linking to advocacy services when people are not able to feel like they can express their needs around their health. That's often quite useful. We explore local emergency food provision with people. For example, I know Give a Gift are on here. They've been fabulous. We've made a lot of referrals to them in terms of emergency food packages and culturally appropriate food packages as well as looking at things like the welfare support scheme with people. We've got a fabulous debt partnership with the Henry Smith project through Better Leeds Communities, where our clients specifically have access to a project where they can have one-to-one support around debt management, budgeting, looking at all those things, and their workers are specifically trained to support people with additional barriers and needs, which is brilliant. And we also obviously look at welfare rights, referring people into welfare rights, ensuring they're aware of their benefit entitlements and their rights around that. In terms of, we work as well with community partnerships. So I mentioned earlier, as well as GP surgeries, we do try and hold some clinics in community venues to be as accessible as possible. Things like hubs, libraries. In this area, I myself run a clinic from the Thackeray Medical Museum, which is brilliant. I'm also just started a coffee and chat session if anybody from this group's interested. Every 6 weeks. The idea is to network amongst ourselves. You come to the Thackeray, pop me an email if you're interested in coming to that. I'd love to hear from you, and just to kind of share what's going on in the area and give each other a bit of peer support, really. So it'd be great to hear from you on that. And also just to flag up, the Thackeray do offer community space for health and wellbeing groups. And I've popped the email on this slides and I will share those. If you're interested, Martha's the worker there. You should more than welcome your email to get in touch to discuss that with her further. And then I've got some contact details. We have a website. Also, you can refer online, as I mentioned earlier. You can refer by ringing the hub, or we also have an email that you can get in touch with us with any queries. And we also have very proud of our podcast that we have on our website. Please have a listen. The very, very first episode's absolutely fantastic in explaining what we do as a service. So if you're speaking to people about our service and they're a bit unsure, you could send them a link to the podcast, and it's a really good way of introducing the service and how we work. And I just wondered if anyone had any questions.
If anyone's got a question, if they want to put the hand up. Rachel's got a hand up.
Hi, Rachel.
Hi, thank you. Great presentation. I was just interested in terms of the waiting list. Are you sort of down on staff, or is that just the demand in the area?
It's the demand in the area at the moment, just the sheer demand for the service. We're fully staffed at the moment, and we're quite a big team in our area in Hatch. It depends on the area of the city as to kind of what the wait times are, and it does fluctuate. But it's around 3 to 4 weeks currently as we stand today. But we just have seen such an increase in demand in the last year, I would say, especially.
I had a question, Natalie, which was about the figures for the referral reasons.
Yes.
And I think you're probably right that nobody would be surprised. I just wondered how they've changed, how they've changed either the reasons or the percentage of, over the last few years, or certainly since before the pandemic. Yeah,
I would say it has always been emotional and mental health has always kind of been top, I would say. That's pretty much been a steady trend. I would say the kind of looking for activities which actually came in third used to be bigger. It used to kind of be up there more so, because traditionally that is what we kind of do, connect to community kind of resources, activities, involve people in the community. I would say that would have been a larger percentage kind of pre-pandemic, definitely. But mental health has always kind of been our kind of mental well-being has always been our number one. But as you know, it links into the other things anyway, and people will potentially put that as a primary reason, but there's often other things underlying that as well. So yeah.
Okay, thank you. Chetna, hi.
Yeah, hiya Natalie.
Hello.
Brilliant presentation, thank you. Just a question. I'm sorry if I missed this, but did you say how big the team was in Hatch? Like how many members of staff do you have in the area?
We have 9.
9 members of staff.
Yeah, 9 members of staff. So there's 9 of us that work across the area in various surgeries. I should have added that to the presentation. Thanks for that question.
Yeah, no worries. And are those full-time staff then, or are they like a mix of
part-time, full-time? Yeah. I can get a list together and add that to a slide if you would like to kind of know who works in which surgeries and which area. Absolutely, I can add that in if that would be helpful.
I think that would be great, Natalie, if you could, and we'll circulate the slides afterwards. Yeah, thank you. Mo, you've got your hand up. You've got a question.
Hi. Yeah.
Hello.
I just wanted to know a number of things. So if we wanted to refer, how do we refer to Lincoln Leeds?
Yeah, there's a couple of ways. You can ring the hub. The number, I'll share the slides at the end. The online self-referral is potentially the easiest way to do it. It's quite a simple referral form. Or you could email as well. We have an email. So yeah, those are the 3 kind of main ways. If you are referring in from a GP surgery, we do have remote booking slots on System 1 that your staff can directly book into as well. So there's a number of kind of routes independent on who's making the referral.
Yeah, because I mean, my experience has been that these people who need link workers or health and wellbeing support are less likely to be able to fill in a form and self-refer themselves. They're just not going to be motivated to do that. So that's something that I think is an obstacle, really. Any form to me as a GP means don't refer. Yeah. It's just a barrier. It needs to be really easy.
Yeah, phoning. Either GPs can book in directly into remote slots, or phoning then could be a potential option. You know, either the client self-referring by phoning, or the GP or the health professional or the worker could phone and give the client details and make the referral there and then. You know, if that's what they wanted, that would potentially be easier.
Thank you.
Thank you.
The second thing I just want to ask is, what's the split between remote and face-to-face working with clients at the moment via Lincoln Leads?
We are still seeing a lot more people are preferring, I don't know the exact figures, but we are seeing much more of a preference still for remote from clients. We are very much offering more and more face-to-face, whether it be in surgeries, whether it be trying to get community venues. We're really trying to encourage that. I think the pandemic has seen that people know they can have kind of telephone or Zoom or Teams, and quite often will prefer that. And I guess it depends as well. We tend to see a lot of clients that maybe struggle to get into a community venue, and it's preference for them to have remote sessions for that reason.
Thank you. Finally, we've got a well-established health and wellbeing team now in Chapeltown PCN. I know that BHR has something similar. So what's the relationship between Lincoln Leads and also the health and wellbeing teams in each PCN? So you're saying that your workload is still very, very high, which surprises me, because I would see that the workload would be going down and shared more equally.
Yeah, we're doing a lot of work. We have one of our workers that's going into Shine to work with the health and wellbeing and the local offer on a Wednesday morning to look to work together about how we can build relationships and work on what our trends. And it would be great as well if I mentioned about, you know, my Thackeray drop-in that I'm going to be doing every 6 weeks, if people can if we can connect in that way and talk about the work and trends and things that are going on, that would be great.
Thank you. Thanks, Mo. Karina, you got your hand up.
Hi, yeah, I'm just a bit surprised. Natalie, do we not have any Lincoln Leads coordinators based in the surgeries? I'm only saying that because Mo, you used to have one. Do you not have them now?
Given that I'm unsure, that probably means no.
I think we're between people, Mo, because I think the new person's starting and coming in tomorrow or this week. I think there's been a changeover of staff, hasn't there, for Chapeltown?
Okay.
Yeah,
cool.
we've recently have a staff member switch over. Yes.
Thank you. And Sir Hale, you've got your hand up as well.
Yeah, can I just finish off what I was going to say? Also in terms of the relationship between, because people know that Fieldwood Factor is a partner of Lincoln Leads, and we're also a partner with Chapeltown PCN delivery partner. So we have been working on in terms of what our link workers do in relation to what the health and well-being. So they are different, but they should be able to link up and work together. But they are different in terms of targeting different communities or different areas, but people with long-term conditions mainly.
Yeah. Thank you, Karina.
Yeah, Karina. Sir Hale, your question.
Hi, just adding to what Natalie was saying, and also in regards to the question that Mohammed had asked previously. So for referrals, for example, for people who don't want to fill out forms, who may not have the ability or have the motivation, and quite rightly, as Natalie was saying, we have a drop-in on a Wednesday at Shine from 10 till 12, where we've got both the patient ambassadors from BHR, PCN and Linking Leads working together, so we can offer that citywide service. Excuse me, and I'm sure Sam will probably touch on that a bit more when he does tells us about the patient ambassadors work over at BHR, PCN. You'd have to excuse us because we didn't create a slide, and I just asked Sam to prepare some information on basically what the common themes were around the patients that we deal with at the moment, and the information around that rather than a slide. So.
No, don't worry, that's absolutely fine. I've got one last question before we move on, and I'm sorry, I'm embarrassed now, I can't remember BSA Wellbeing, your name, sorry. You're on mute, I think.
Sorry about that. I just wanted to say, can you send us the dates for the Thackeray Museum meetings again? Because I went to one, it was really productive. We've ended up linking it with Touchstone and ended up helping one of our members really well. So that was a really positive partnership for us. So we're definitely here at BSA. We do want to be attending those Thackeray meetings.
Of course, we've only just set the date, 24th of April. I'll send it round with the slides. Thank you.
Great, thank you. Great, thanks again, Natalie, for that. That's really well received and useful. So going to move on now to look at some of the local practice or general practice based offers. Firstly from Chapeltown, and I'd like to welcome Tracy, my colleague, occupational therapist, who's our clinical lead for our health and wellbeing team in Chapeltown. Tracy, over to you.
Thank you, Camilla. I'll just hope the technology works. Right, can you see that? Right, great.
Yes, we can, yeah.
Yes, thanks.
Brilliant. Right, so as Camilla said, I'm Tracy. I'm an occupational therapist working in the health and wellbeing team in Chapeltown. So we're a fairly small team. So there's myself. We've got 2 whole-time equivalent social prescribing link workers split across 3 staff. So like Natalie's team, not everybody's full-time. Same for health and wellbeing coaches, and then we've got part of a care coordinator. So as Karina's mentioned, we work in partnership with Feel Good Factor. So the team, aside from myself, are employed by Feel Good Factor and then work in the PCM. And because you've given me a platform, I'm going to talk a little bit about OT and just talk a little bit about why social prescribing is a really good fit with occupational therapy. So linking people with communities has always been a core part of OT work, along with sort of that patients focused, what matters to me, doing for, not with type of approach. So within the health and wellbeing, I provide the clinical supervision and oversight for the link workers. I won't dwell on this bit too much. I think we all know what social prescribing is by now. One of our main observations in Chapeltown is that people have quite complex lives, lots of complex needs, if we think about those social determinants of health that we all know about. So our link workers within the team have a holistic approach. They provide social prescribing to connect people in with community groups, emotional and practical support, with the aim that people will become a bit more self-sufficient, more independent, feel a bit more empowered to manage their health and well-being. So our referral, we have 2 streams of work. So we work on a referral basis, where what we would call reactive engagement. So it's adults, people with long-term conditions, people who might be lonely or isolated, people where their health may be preventing them from being able to do the things that they want and need to do, people that might need additional support or have got complex issues that are affecting their well-being. And then we have a proactive stream of work where we kind of get lists from the practices. So we're looking at people who are frequently not attending appointments, either at practice or across the healthcare system, people that are sort of repeatedly not engaging in their annual health reviews, those patients that we might class as hard to reach. There might be patients that we're worried about for all of those reasons above, and the frequent attenders. And like Natalie was saying as well, a lot of the common issues that we've noticed in Chapeltown: housing and access to support with housing, mental health, accessing specialist services there, money worries, debts, issues with benefits, isolation, employment issues. People have got quite complicated family situations. They might have caring responsibilities, substance abuse. We quite often come across poor literacy or language barriers. So looking at accessible information is really important. And just knowing where and how to get help. People know how to contact their GP surgery, don't they? But they don't necessarily know what other support is out there. So I guess we're there to bridge that gap. So the link workers support people by providing practical support, emotional support, similar to what Natalie was saying, as, you know, being a listening ear for someone. We support with onwards referrals for other support or to access specialist services, and we will support people to engage those services. If that means we go along with them at first, we will do that. And we've got links in with other community-based services and activities, and we try and have a solution-focused approach. So this is done by having what matters to me conversations, exploring people's interests and setting some goals. We have a variety of approaches, so we might have just a light touch approach, which might just be a conversation and some signposting, providing some information for those people that are able to then access things more independently. Or we might work with people more intensely, where we'll provide a mixture of phone calls, face-to-face appointments, where we'll see people either in the GP surgeries, in their own home, or elsewhere in the community. We don't have a time limit on our interventions. We have rough approximations of how long we think we're going to be working with somebody, but it's not set in stone. And we will accept re-referrals back into the team. And patients may move between team members, such as myself or the health coaches, or we might jointly work. So again, probably repeat a little bit of what Natalie said, but some of the services we link in with, this is just a few. As you know, across Leeds, there's so much going on to support people. So we've got a whole list there. I won't read it all out. But I think what's unique to the area we work in is there's loads of very localised services. So sort of in the Moor Allerton area, there's the Moor Allerton Elderly Care, which provides a great service. And there's some of the faith-based organisations which are great to access for support for certain groups of patients. And it's an ever-evolving thing. I'm trying, Camilla, you'll be pleased to know, I'm doing it on TeamNet. I'm trying to get everything in one place so we know where to look to find all of these things. And I guess once I've collated it all, keeping on top of it and updating it, it's probably going to be a bit of a labour of love. And then I've just got a couple of case studies just to illustrate the points. So this is from one of our social prescribing link workers who initially received a referral for somebody for care restraint as their husband had dementia. So after sort of initial contact, the link worker put them in touch with carers Leeds, which provide a great service and have dementia-specific services as well, and accessing benefits and things like that. They looked at care and repair for some issues around the house. They signposted them to the Jewish Welfare Board for activities and a befriender. They supported them with some sleep hygiene and put them in touch with the voluntary services, as well as accessing things through the Alzheimer's Society. And then I've just got one more a bit briefer, but working with somebody who was struggling with weight management, not engaging with their annual health reviews. So they looked at what support was available for their weight management, directed them to One New Leeds and encouraged them to join the Zumba sessions that are at one of our local coffee mornings in Chapeltown. And this is somebody that's now been discharged and just touches base with regularly at the coffee mornings where they're doing Zumba and they get the social support and their physical activity. And obviously the bonus is they've lost some weight. Thank you. Any questions?
Thank you, Tracy. Yeah, any questions for Tracy? No. Okay, let's move on. There might be some later that are relevant for you, Tracy, some questions. So let's move on to BHR and well, Hamara colleagues.
Hi.
Sahel, can I pass on to you? Is that right? Yeah.
Is it you, Sahel, or is it me?
Or both of you?
It's Sam. It's Sam on this
okay.
one, yeah.
Okay,
Thanks,
great. Sam,
well,
over to you.
Well back-heeled there, Sahel. No, it's me. It's me. Quick introduction. My name is Sam Hurst. I'm one of the patient ambassadors working for Hamara within the BHR PCN. We have a team of 9 and we look after 10 surgeries. I can recite them if you like, but you probably know they are anyway. But basically, Leeds 7, Leeds 8 and Leeds 9, various surgeries. As you know, it's one of the most deprived areas in the country. We very much as the other organisations that are here, we're all in the same business, so to speak. There's a lot of health inequality, there's a lot of housing problems, a lot of mental health problems. The team varies in different levels of experience. We all cover the task. We will all cover similar cases, but we have a couple of people who are more expert in domestic violence. We have someone who speaks Romanian and Arabic who tends to deal with the Gypsy Roma community in the area a little bit more because she's got the language skills and also understands the culture and a lot of the problems behind all that. People that are working specifically as well in mental health support. But as I say, the things that we're covering, Lincoln Leeds and the other organisation from Chapeltown, you've already covered the kind of things. We're all covering the same kind of things. The issues at the moment that we can see, I think Natalie, you gave the specifics as to your breakdown when it came to mental health and housing. We are obviously seeing exactly the same. The common problems. When it comes to housing, there are so many issues at the moment. Waiting lists, as we know, in Leeds, we've got issues, massive issues in Leeds compared with a lot of other areas in Leeds, where you've got 25,000 people on the waiting list on Band A, and you've only got 5,000 houses a year that are being put out. And those 5,000 are only being given out to people who are bidding on a regular basis. So, you know, I don't want to sound too down. The situation is very, very difficult. People are living in difficult situations as well. So again, I don't want to cover all the same things, but we obviously are using the same resources. We are a signposting agency, and we will signpost to the relevant people. I just want to give you an idea, because we had a discussion amongst ourselves and basically said the things that were predominant at the moment as the problems in the area. As I've already mentioned, housing problems, damp, mould and overcrowding and years of waiting to get a council house. The situation with housing at the moment, there does seem to be a heck of a lot where repairs are waiting 12. I have one patient where repairs have been waiting 12, 18 months. And it's just a nightmare. She's got COPD, she's got asthma, and she just can't get anything done. So anyway, that's all the negative stuff. The other issues, obviously, we're seeing in this area with housing conditions for asylum seekers and getting things sorted out. Housing, you know, what you see on the media is clearly not the case. Housing conditions for asylum seekers are very poor. And again, we're working with the relevant agencies to try and improve that. Mental health problems, particularly since COVID. When I joined Hamara, it was at the beginning of the rollout of the vaccine, and I have seen in 2.5 years a massive difference in waiting lists when it comes to, I think Leeds Mental Wellbeing Services was about 16 weeks, and now it's about 12 months, and that's no reflection on the service in the slightest. It's just the fact that with all the issues that have come about after COVID, there are a lot more people applying for the services. So again, that gives you an idea. Housing activities. Also, I think a lot of people have come out of the other side of COVID still struggling because they were socially isolated. I think a lot of people are still needing to get out there and do more physical activity. And again, we're working on that as well. I'll give you an idea of some of the projects that we're working on at the moment. Myself and a colleague are working with Carers Leeds, trying to raise awareness so we can get more people registered as carers on the books. We've got drop-ins at Shepherd's Lane Children's Centre, where a couple of colleagues go down there once a week. We have got the Conversation Cafe at Shine on a Friday morning. Sahel has already mentioned the drop-ins on Wednesday at the Shine Centre, where we're working with Lincoln Leeds. So obviously that, like you mentioned, that means that is it's a connection to like a citywide service. So then we've got the digital drop-in on the Wednesday afternoon, which again, I think Ellen, you've been involved in that. We are running a pain management group out of Bellbrook. One of my colleagues has been doing that. It's an 8-week course, and that's been well subscribed to as well. We're running a mental health arts group out of Noel Mount, which has been really, really successful as well. A lot of people have been going to that. I will come on to mental health when it comes to two of the big projects we've got. You're probably all aware, or most of you will be aware, that there's a programme called the Heroes Programme. Maybe you're not, I don't know. It was designed and set up by a lady called Miranda Arie. She's never off the BBC. She's been on the One Show. She's on Radio Leeds and Look North all the time. But she designed a fantastic, revolutionary mental health coaching programme, and it's been incredibly successful out of Bellbrook for the whole PCN. Two of my colleagues, Sarah and Sharon, have actually started facilitating those groups as well. And I think there are about 85 people on the waiting list at the moment, and they run every 2 or 3 months, every 3 months, I think, and it's an 8-week course. So it's a 12-week course, sorry. So that's been really successful. And then another project, which I'm going to hold my hands up and say this is me, is that we are running a drop-in. It's a course. It's initially an 8-week course for men, and it's a men's mental health peer support group called Man Talk that we're running on a Monday, 12-2. We've been getting between 5 and 10 people there every week, and that's just from the off. So we're wanting to promote that more, but that's going really, really well. And as you probably know, men don't talk about the mental health very much. We're not very good at that. But I have to say it's been great, and it's been peer support where people have been able to get things off the chest, and then the second half we actually do some mental health coaching, like the GROW coaching, self-compassion, etc., etc. So that's just to give you a picture of the kind of project that that we're involved in. What I'll do is, as well, I will give you a couple of cases. Let's have a little look. A couple of case studies from my colleagues, again, just to show you the kind of things. So one of my colleagues, okay, here we go. One of my colleagues has recently been dealing with, he's been supporting a Syrian family. The referral was originally about the grandmother. The family moved to Leeds from Scotland. A son is in prison, but his wife and 3 children live with the patient. The family suffered from physical, mental, social and financial issues. She had considerable health issues, but above all, not knowing where services are and how to access them without being able to speak English was making the problem more complex than it should have been. A man has managed to help the patient receive PIP, and the daughter-in-law is getting carers allowance and the children to school and nursery after about 3 months of support. So that's kind of one of the rewards of getting something done. And here's another one. Let's have a little look. 24-year-old female living with mum and siblings, referred for housing and employment support. Patient would like to move out of the house and bidding on Band C. Patient shared as a child, was sexually abused by father and neighbour on the street. Patient still lives in the same home and bedroom where this happened and has not told anyone. They would like to speak with a GP but does not know how to share. Completed all the information discussed in patient record, and patient advised GP to read and see if patient get a letter to change banding. The GP wrote the letter, then the banding has now been changed to A, from C to A. The other thing as well that's come out of that, by recognising the mental health problems that the patient was having, the patient is now attending the Heroes group for mental health support and is now actively looking for work, attending job fair events the PA provided and received help for a CV. The patient has asked to close the case as they are in a much better place and no longer need support. So again, it's the obvious stuff that we do, but it's that kind of satisfaction when at the end of it, somebody's got some help. Just a final thing, the way referrals come into us, we are based over the surgeries in the PCN. So we have two main rooms, one at Shine and one at Bellbrook, but we also have access to other rooms at Bellbrook and all the other surgeries. So we tend to float around between the surgeries. We have a rota, but it means that our presence is in the surgeries. So we will talk to reception staff. There's a presence, the flyers are out there. So we are actively encouraging the GPs and the HCAs to referring through. They can also refer through, patients can also refer through our care coordination hub that is based at Shine. We've got flyers and the phone number is on there, and they can refer in at any time. It does predominantly come through the GP surgeries. The final thing is we do work slightly different to Lincoln Leeds in that we don't have a time limit. It's just the way it's set up. We don't have a time limit. It's very rare a case would go over 12 weeks anyway, but sometimes you're dealing with a patient that will every time you want to close him, there will be another problem and it's a re-referral. So it just means that we've got a little bit of flexibility to do that. As regards waiting times, we've got quite a big team. So I would say usually it's between 1 and 3 weeks to get a call. You know, the caseloads are getting bigger, but as I say, we are quite localised. We don't have not the disadvantage of covering the whole of Leeds. It's a smaller organisation, but we've got a smaller area to do. But hopefully that gives you a picture of what we do, where we are, and how we do it, and why we do it. So that's me.
Thank you, Sam. Great. Any questions for
questions?
Sam?
I was just going to say that. Make them easy.
Chetna.
Yeah, I just had one, Sam, really useful. All the information today has been really useful. Thank you for those. Just, you know, the drop-in sessions you mentioned, are they quite popular? Do you get people coming in? How do those work?
They start quiet and build up, basically. They are still fairly quiet at the moment, but we have had people at the drop-ins on the Wednesday morning, maybe 2 or 3. I'm not sure about the digital ones in the afternoon because I tend not to cover those. The Conversation Cafe, Aman and Lauren tend to run those, but yes, I think they still do get a few people there. So again, they're very useful. We need to keep promoting them and getting it out there. And obviously things like this are a great way of hopefully getting the numbers up and making it more effective. But yeah, it's effective so far, but it's like anything else. When you start, it's quiet and it builds up.
Thank you. And one question from Ellen before we move on. Ellen Fisher, hi.
Hi. It's not a question, it's just adding on to what Sam said. So we also have at the Shine, there is 2 health and wellbeing coaches and 3 care coordinators. And I just want to add, we have a room at the Shine every Wednesday, so we do the digital drop-in and also the drop-in in the morning. We're also setting up a menopause support group for women in the area, and it's been booked fully for this month, next month, and then the following month. So it's been really popular. And then we've also set up a stress awareness course as well, and that has been popular as well. So it's been starting to book up slowly but surely.
Thanks, Ellen. Sounds like there's loads of good work going on all over the area. That's great. Thank you. Okay.
Sorry, I just wanted to add, Sam, if you wanted to promote the drop-in sessions, then my colleague Tina has a really good mailing list. So if you wanted to advertise those more widely, then we could help with that. So just wanted to add that.
Sale. Can you look at that?
Yeah,
from the point of view of the promotion?
I was just about to put it in the chat.
Yeah. Okay.
Really
I'm just gonna. Yeah. Thank you. I'm just gonna move this on a bit because I'm just conscious of the time.
Just call me. Yeah,
okay.
Yeah. Thank you. So we're going to move on now. We're going to hear from Rachel and colleagues in public health team, because there's a pilot going on locally which links social prescribing with active travel, I think physical activity, 3-year pilot scheme. So I'm going to hand on to them so we can learn about that. Sounds really interesting project, Rachel.
Hi everybody. Right, let's try the tech. Let's see if it's going to play. Oop. Has that popped up?
Yes, it has, yes.
Oh, good. It's wonderful when it works. Right, there you go. Right, there we right. Okay. Yeah, so as you say, this is a pilot. It's a 3-year pilot. We've already done a feasibility pilot before this, which happened last year. And we had to supply all sorts of evidence and stuff to the Department for Transport to apply for a grant for this piece of work. So we did that last summer, or sort of late spring. We heard in August that we've been successful. So we're one of 11, I think it is, local authorities across the country that have got funding to do a 3-year pilot. So we're actually live. We started in November and it's running till November 2025. It's not doing January to December like a lot of things do, just to add things into the mix. So this is our team. I think we have got Maddie on the call as well from Urban Foresight as well today. So I'm one of the leads for this. As I say, I sit in public health. So it's being led through the council, so led by public health with support from colleagues from city development and also active leads. And then we're working with 3 organisations, some of which you may already know of. So Urban Foresight's one, which is going to be running and leading all the monitoring and evaluation we need to do for this. Magpie, who are leading on the communication side and some of the community consultation side, or the branding and stuff like that. And the insight work. And then we've got Arup that are looking at the travel infrastructure side of it. So it's quite a big team. So the geography of it is BHR specifically, so it isn't going to stretch to Chapel Town. That's the bad news. It is Bermontos, Hare Hills and Richmond Hill PCN. We had to go for one PCN rather than an LCP geography. However, we're really hoping that by running this pilot and hopefully getting an awful lot of evidence back, that we can then use it to scale up across the city. So these are the objectives. We know there's challenges within BHR. There's a lot of assets within BHR. It's important to say as well. We do know there are challenges in terms of green space and getting out and about. We were told lots of stuff around crime and grime concerns when we were doing feasibility, and just how safe people feel sometimes when they're out and about. Things like storage came up for bikes. Sort of buddying groups, some great examples of stuff happening as well. So I want to build on some of that and strengthen some of that. We're also going to be promoting physical activity through walking, cycling, and I've got to add wheeling to be really clear on this. Is also is around supporting people who may have limited mobility and where some adaptive bikes may not be suitable. So I'll come on to that in a second, but also walking. So we'll be setting up a range of interventions to support people in getting out of the front door and supporting that with what needs to happen on the infrastructure side. So we will then be looking at providing people with active travel choices. So we're looking what the Department for Transport calls a modal shift in behaviour, sort of getting more people out using the buses or walking in or whatever it is. The other thing as well is that we're trying to incorporate a family approach to this. That's one thing that we were quite unique at in the bid. So we will be working with schools. We've just started a subgroup in terms of the schools' approach for this as well. So as I say, to make clear in terms of what this is. So it's active mobility, basically. It's movement of people or goods through non-motorised means. Now, if you've got an electric cycle, I think that might be slightly tricky, but either way, around physical activity. So yeah, wheeling. So we're including scooters, we're including wheelchairs, we're including mobility scooters as well. And these are, again, some of the things we've heard about. I've mentioned one of them already. So we've heard about missed opportunities to refer people from social prescribing into walking and cycling initiatives. We've heard how hard it is to get comprehensive lists of up-to-date information and to keep that maintained in terms of offers for people to take up and for social prescribers to use. We've heard about the economic side in terms of around bikes in particular, maintenance, cost of bikes, but also things like electric scooters and stuff as well. The storage, again, a lot of perception, sadly, that people perceive that walking, cycling and wheeling aren't for them. And that, again, the need to increase the environment as well is really important. And again, that crime and grime sort of belief was quite strong. It varied across some of the three communities. Obviously, the three communities are very different, and that's another reason why we deliberately went for BHR. We wanted different a range of different communities. We wanted areas that were flat, we wanted areas that were hilly, we wanted areas with back-to-backs, etc. So there's a lot of different needs. So these are the 7 things, we're calling them logic models, or 7 interventions for what we are going to be doing. So there will be a big strand around communication, and we're just starting to kick off the consultation around the Walk It, Ride It campaign, which you might have used previously, to see whether that's relevant for this. Can we build on that, or whether we might need to tweak it or to do something different? We'll be doing a lot of work in terms of the areas around traffic free spaces, looking at the parks, looking at lighting, looking at all sorts of things, bins, benches, toilets, etc., things like that. The urban trails, we're going to be setting up 3 urban trails, one in Bermontoffs, one in Hare Hills, one in Richmond Hill, of different lengths, different types. So we want to bring in around waymarking, route planning, businesses to help have places for people to stop. Also the cultural side, we wanted to bring in historians and sort of local people to share the stories so we can build this into the trails. We'll be running what we're calling a First Steps to Walking strand, which will be strengthening the role of the community providers in being able to refer people in, and then for social prescribers to be able to then refer out to providers of walking and cycling initiatives and wheeling as well. So we could fund things like access to kit, walking boots, bikes, etc. We're looking at a buddying programme as well, and all the things that are needed in between a point of referral to something and people turning up, and what else is required, certainly around physical activity. We've got a Learn to Ride strand, so we will have a couple of posts that are going out to advert imminently. Walk It, Ride It officers, I think we're calling them now, and Walk It, Ride It development officers, one of which will be cited very heavily within the community, and we'll pick up the links we've been developing with social prescribers, and also within the community properly as well, in terms of with all those organisations. We've mapped about 120 various community organisations in the patch already, and I'm quite sure between us all on this call there's probably another few hundred as well. We'll be looking at bike libraries, bike hubs, strengthening what there already is, adding to it, putting in other things that might be needed, and also a loan scheme to look at how we can strengthen active travel to employment and for skills development as well. Oh yeah, I've said that bit already. The first point. So Maddie's on the call from Urban Foresight. So we've got an awful lot of monitoring evaluation to hit for this in terms of Department for Transport, so we can really push forward why this is so important. So we've got to capture data and evidence at every point along this programme in terms of who's referring, and then the journey that the person takes once they've been referred and the impact that it's had on them, their emotional health, their physical health, etc. So as I say, the subgroups are forming as we need them. The schools one's up and running at the moment. We are contributing to the Bermontoft Gala and Lark in the Park that are happening in the summer, and we are wanting a movement sort of thrust to those two big events where we'll be able to bring a lot of kit out in terms of come and try sessions. And we're continuing to explore links and relationships with a whole range of third sector providers across the patch. So in terms of where this potentially links to Hatch, I've had a look at the priorities, and I do think hopefully this will add value in terms of diabetes care and support, the whole agenda around community wellbeing, mental health and serious mental illness as well. We hope it'll be an example of a community-centred approach, and we do really want to engage with the community, and we want to make sure this is driven as well by the needs and the views of local people as well. It's great that Nina's on the call. We are quite far along now in looking at using the musculoskeletal clinical pathway for this as well, which will also link to one of the other programmes, which is the exercise referral scheme. So which is really good news. We do have some contacts with other potential clinical pathways like the Shape Up for Surgery that LTHT run on the St James's site. I think it's on both sites, but in terms of this patch, it would be St James's. And we've had some interest from neurodiversity as well in terms of benefits of walking, cycling, wheeling to people that are experiencing balance problems or who have suffered a stroke. We will be having an event next month, well, April, May-ish, in terms of bringing together a lot of those providers, community-based organisations about the pilot and how we can continue to drive this forward, what things they need. So we did have some questions for yourselves, and what I'll do is I'll shut this down in a minute and I'll copy and paste these into the chat. But what would be helpful is, how would you as a partnership like to be kept up to date about this, and how often? And I'm conscious, obviously, this is a really vibrant and busy group, and I don't want to set something up that might not fit very well, or might be too often or not often enough. If you do want to get involved, I'm going to put my details in the chat. If there's anything that you think we really need to know about that's really important and that we need to consider, please shout. And again, yeah, the place side of this is in terms of the geography, the topography, the environment of all three, anything that we might not be aware of. We've heard all sorts of fascinating insight in terms of, say, Beckett Street Cemetery, for example, and Hare Hills Park, all sorts of stuff. And then we had a couple of questions from Arup in terms of what do you think the opportunities this might provide? Sorry, there are a few questions, so you don't have to answer them all, I promise. And then, are there any key barriers that you think we may miss or might have missed in terms of people to get involved? And then obviously last but most important is, have you got any questions for us? So I will stop the slideshow so I can actually see you all again, and I'll put those questions in the chat and my email address, because I appreciate you might need to have a ponder. And thank you very much.
Thank you. Have we got any? That's really interesting to hear about. That sounds like a really broad and a broad approach. Any questions for Rachel? Yes. BSA?
I just wanted to say, has some problems there. We've been working with Leeds Older People Forum and looking at some transport problems already in this Bermontoft area, and we've had some subgroups going, and we've had some little trips out, people using bus routes and walking into Leeds. It's something that we would definitely be really interested in. We found a lot of our members struggle with like bus routes or mobility or getting around or just general green spaces in the area. We have a lot of members who want to go to like walking groups or things like that, but there's nothing in the specific area that we can refer on to or do at the moment, because like a green spaces or times for activities or what have you. So it's something where definitely a lot of our members are really passionate about. So we really would want to be involved.
Right, I'm going to put my details in. What's your name? Sorry, because I've got
it's
this.
Emma. It's Emma. Yeah, it's at Birmingham Senior Action.
Fab, brilliant. Thank you. Yeah.
Lovely. I can take notes for this bit, don't worry.
Thank you for your question, Emma. Thanks. Victoria.
Yeah, Rachel, I would just talk in relation to the neighbourhood teams. One of the barriers that we're coming up against is around travel and transport issues, but actually around a lot about changing people's behaviour and mindset with the patients. Because we're doing we're trying to encourage people to go to integrated clinics, we're developing community hubs, and we're working with Enhanced, and time and time again across the north, just not Chapeltown, is one about transport and people. We're checking that people have got the right access to benefits as well, and stuff, but people are a lot of the time refusing care in alternate places or going out to drop-in centres, day centres and stuff like that because of transport issues. So I think there's a lot of work to do around accessibility of transport, as well as changing people's mindset as well.
Yeah, absolutely. Yeah, yeah, thank you, Victoria. Yeah, absolutely. If you've got what'd be helpful is if you've got anything sort of written down about that, any sort of case studies or any anything you could send our way, that would be really helpful. But I've made a scribble in the meantime.
Yeah, what I'll do is I'll ask the operational and clinical lead at Chapeltown to pull some notes together and stuff. And it might be worth you coming to visit the team, and they'll be able to talk to you as well about a lot of the barriers.
That would be fabulous. Yeah, no, I'd love to come along. Thank you. Yeah, by all means. Yeah,
and
great.
Victoria, it just strikes me, just with my Chapeltown PCN hat on rather than my chairing the meeting hat, might be helpful to link up, because I think these are probably some issues facing all primary care. I think we see patients who are quite willing to travel for secondary care, and they're not so willing to travel for primary care. And as you say, it's that change of mindset that we need to coach them into, as well as removing barriers like transport and stuff. So it might, let's link up outside this meeting to have a talk about that.
Yeah, absolutely. I mean, we've been lots of discussions with the Enhanced partners, and like Irish Health and Homes have been able to offer some transport, and the capacity has just been used up straight away, and stuff. So we are looking at other means of resource available.
Thank you. Nick from Chapeltown CAB, you got a question.
Yes, a couple of things. One, what will be the impact of the cut in active travel budget? I think it's been slashed by, I think, 200 odd million, hasn't it, nationally, which is depressing. But also, what we're finding is that more and more, as people are struggling between, eating and heating, then money for transport is just. So what we also know, if we're being a bit strategic and looking to the future, is the families that and the households that are having to make choices gradually just become more and more isolated and withdrawn, I suppose, and can't even participate in free events because they can't afford to get there. So that's a concern.
Absolutely, yeah, absolutely. And we've interviewed 12 social prescribers from across Lincoln Leeds and the primary care team from BHR, and 4 themes. In fact, I've got them here, so we just presented them yesterday. The 4 main themes that have come up is that being able to support people to take that very first step, literally, is a significant challenge, and that there's been a switch over the last 6 months where people are now, rather than emotional and mental health support, being sort of a big main issue, it's swapped to around practical support in terms of finance and debt and housing, with mental health going as a second, which is a huge shift. Also, the benefits of walking and cycling and wheeling they're not sort of out there in the public domain enough. And again, that the information and what there is happening is very hard to keep on top of. And things, you know, partly because of the funding environment we're all in, but, you know, how we can bring that together. And, you know, there's an awful lot happening, but how can we best share that across the system?
Thank you. And Mo, you've got a question.
Yeah, I think this is a really timely and very, very important agenda. But we really have to put our money where our mouth is. Really, really think about this. This is going to be really difficult for you, actually. You've got a huge challenge, especially for people who don't identify as sort of walking for them, etc. So, you know, even I'm not, you know, I like a cycling kind of guy, or, you know, going out into the Peak District. It just doesn't, I just, you know, it's not something that really, it's nice when you're there, but it's difficult to get there for me. So there's a real barriers, I think. So you need to think very carefully about the messaging and the messenger. So so we need to look at you know, who are people that look like us, to get some of these messages out. And I think that you've got a real opportunity here to work with things like our health and wellbeing teams, our work coaches, our patient participation groups, linking in with things like the park run, to really do things, because loads of good work's already going on. But I think we would welcome your participation in that. I think the key here is that you need to make this quite vogue and quite trendy, and that might be difficult to do, but it needs to be a movement, I think.
Absolutely.
Yeah, but we're very happy to talk to you and move things forward. I'm very excited about this. Yeah.
Thank you. And again, you know, we do have, you know, setting up various groups as we go along, but I'm conscious that it's very relevant, obviously, to a lot of people on this call. So how best we sort of keep you up to date, you know, or do you want to just want to know, but just want to call me in whenever, you know, I'm quite happy.
I'll certainly get you on my radio show.
Oh, right, that's exciting. Absolutely.
Yeah, I'll certainly do that.
I'll have to practice for that. I've never been on the radio. Right.
Don't worry, it's a conversation. Very nice one. Okay.
No worries.
Great. Thank you. Emma, you've still got your hand up. Is that from before, or?
No, it was just a comment on Victoria's comment, just saying, actually, we know here in Hans, well, I'm the Hans worker here at Birmingham Toss, that we find actually people are accessing medical care because of transport and physically they can't get out. And it's about trying to get that shift of getting people. We're setting up a community hub here in the next couple of weeks, and some of the initial conversations we've had with members is, well, why should I come there when the nurses come to me already? And it's making that point, actually, people do struggle to leave the houses to get medical support, and it's how to support people best to help them to come out, and once they're out of the house they can start doing like social activities and things like that. But it's that general barrier that we're facing daily, which I think is really important that people know, to be honest.
Thank you. Thanks, everybody. A really useful discussion, I'm sure, for Rachel. And thanks, Rachel, for your presentation. It feels like we've connected lots of people there, which is great. We're going to move on now so that we finish on time at 4:30. So I'm just going to hand on to Rachel from the LCP team, because she just wants to give an update about the areas of focus for the LCP for next year. We had some feedback at the last meeting, and we'd like Rachel's going to be summarising it back to everybody. Over to you, Rachel.
Thank you, Camilla. Hi, everybody. So yeah, this is a bit of a summary and a playback of the feedback that you guys gave at the last LCP meeting around priorities. You thought it was really helpful to take that stock take exercise and celebrate some of the achievements. But you did mention forward some of the principles that would be important in taking forward any priority. So just to pick a couple of those out, the priorities that we do have in Hatch, you'd like something that all partners can get involved with. You like something that's focused on practical delivery. Good to be ambitious, but perhaps not spread ourselves too thinly, and ultimately that they are fun. In terms of feedback around priorities, there was a whole wealth of enthusiasm within the meeting, and then also after the meeting around food as this new priority. So something that was of interest across all partners. We do appreciate there's lots of really great work going on already, so we're going to be undertaking some scoping to understand that great practice, what's happening already, where would people like to see this priority go in terms of co-design. So we will be getting a survey out to partners. We're really keen that we don't lose what we've already developed, so building on the work with diabetes, with Nina, and I know that's moving into weight management and also around cost of living. There's just some ideas on here. So we've been hooking up with Foodwise leads and around Zest and some of the other local partners who've got a real passion and energy around food. These are just some ideas of the things that we could take forward. So really having a theme session for Hatch around food, some key messages that the whole workforce will be able to promote. There was a suggestion around promoting healthy start vouchers, so vouchers for pregnant people or who've got young children in terms of accessing free and healthy fruit and veg and milk. Is it something that we can weave into everybody's organisation induction in terms of it being an important part of being everyone's business, and then also exploring sort of training and how that might work. For domestic violence and abuse, everybody told us quite clearly that there's still an interest in continuing with this focus, that there's a momentum, but it does take time to change culture. We have a great group of partners behind this, working through Chetna's leadership, but it would be great to welcome more active partners into the group. You did suggest that we have a very clear focus, so actually we have some tangible objectives. So perhaps this time around, it's around really focusing on community ambassadors and training, around looking at safe spaces, so places where people can go, have some time out, access the telephone for free, have access to specialist domestic violence resources if they need to get help, and around sort of routine and triggered inquiry across primary care. So actually, how do you open up that conversation? So that's another priority that will be continuing, and it'll be great to see the legacy from this one. And also there was a lot of appetite around the face-to-face workforce events. So we'd really like to get this started perhaps in May time, but this opportunity to really get partners together, including your volunteers, get to know each other, connect again, build the trust and relationship, find out what you've got in common, learn together around topics. So we're going to want to make that a really vibrant session. So that's something we're going to try and aim for once or twice per year in a community venue. So that's a quick summary around the priorities. And of course, we'll have the community mental health transformation and the SMI work. So severe mental health illness will continue in the background. But these really felt like strong things that people wanted to get behind for the next couple of years. So yeah, lots to opt into.
Thank you, Rachel. It's really helpful for us on the exec to have everybody's feedback into as we set our priorities. So it was a really useful session for us last time. I'm going to ask quickly Rifat Malik to give us a very brief update about our Community Grants Fund, which is now live.
Thanks, Camilla. Yeah, hi everyone. The Hatch LCP Community Grants is live. If you've not seen the flyer and the information, please contact me directly on grants@giveagift.org.uk. We've got about £118,000 to distribute within the LCP Hatch area. The sort of main activities we're looking at is supporting or dealing with the food insecurity, tackling fuel poverty, enhancing reach and inclusivity of mental health support, the health and well-being of young people, families and children. We have got the guidelines, we've got all the information. There are two grants. There's a small grant for up to £1,500 and a slightly larger one up to £5,000. The closing date is next Friday, the 31st of March, but depending on how many applications we receive, we may have a rolling programme, so there may be another round of grants coming out. But if you need any more information, please do get in touch with me at grants@giveagift.org.uk. Thank you.
Thank you, Rifat. Fantastic. Okay, that's bringing our meeting to a close now. So just a few words about our next meeting. So our next meeting had been scheduled for the 18th of April, but I believe there is another large organisation going on, another large event going on in Leeds that afternoon. For a lot of third sector colleagues are going to be at that meeting. So we have decided to stand down the April meeting in order that people can attend that other event, which means that our next meeting is Tuesday the 16th of May, at 3 o'clock as usual, and that is going to be a face-to-face event. So please mark your diaries now, allowing travel time this time. So as Rachel was set out about bringing the workforce together so we can start to sort of reconnect after the first time really since the pandemic. And I guess just to say, I won't be at that meeting. I'm having a few months planned break from work, May, June and July. So sadly, I won't be able to be at that meeting, which is a real shame because I really remember the similar events that we had a few years ago and how brilliant they were and how energising and enjoyable. So I won't be here, but there will be someone just as fab as me chairing these meetings in my absence from the exec, conversations ongoing. Okay, so that brings our meeting to an end for today. It's been great to see you all. Thanks everybody for contributing your questions and especially to the speakers, their presentations. It feels like it's been a really positive meeting today. Thank you all. Bye-bye.
Thank you. Take care, everybody.
Bye, everyone.
Thanks, everyone. Bye.
Bye.